All right. So, wider range of photon energy, okay, meaning that, so when you have a wide range of photon energy, when you increase your KVP, all right, remember, why do I say a wider range of photon energy? Because KVP is just the peak. That will be the maximum. But you're going to have a range of energies in that. When we do this, right, this is 120 or whatever KVP you selected on your panel. But only this little portion here is at 100 KVP. Everything else here has other energies, right? So that's what we said, the wide range of photon energy. When you increase the KVP, yes, Garrett?
It just relates to like voltage ripple in a way, or no?
Yeah, but this is specifically to your KVP. What I'm trying to get it clear, and I said it many times too, okay, in the past, but I just want to emphasize it, is that when you go into your panel and you said 80 kVp, okay, is everything at 80 kVp? No. So that's what I want to get clear, okay, for everybody. And you have a range of energies here. Some are going to be at 80, some at 100, some at 20, 30, whatever. Make sense? Okay, so when you increase the KVP, if you keep going to the side, that range is also increasing. All right, good. Okay. All right, and so that will have a greater range of exposures and greater range of penetrability. Okay, good. And so careful here. All right, is this true?
No.
No, good. This is not true, okay? This is not true. This is a greater amount of a scatter reaching. Finish it up. Reaching the image receptor.
The energy.
All right, good. Just checking. All right. All right, and when you do that, okay, what happens is you have a longer scale of contrast. This is saying that you have many shades of gray. If you do the opposite, if you begin to decrease the KVP, you have a short scale of contrast. Right? Monique? Good? Ethel? Okay, good. All right, so this is what we have, Kilovoltage under contrast. Okay, so here we go. We have the photons, okay, and some of them are going to go right through. Some of them are absorbed here. You see, this is absorbed. That's why you have the clear areas, and some of them are scattered. Those are going to be the gray areas. Okay, and some of them are going to go right through it. Dark areas. Make sense? Good. All right, amount of irradiated material now. Oh, let me just say one thing to get it out of my chest. All right, longer scale of contrast. Put equal sign. Okay, low contrast. That's, you can use either term, either or. Longer scale of contrast or low contrast. LOW, low contrast. Okay? If you have a short scale of contrast, high contrast. It's out of my chest.
But I'm confused. So there's many shades of gray in long scale.
Yeah.
I thought many shades of gray equaled more contrast.
Yeah, that is low contrast.
No.
But it's low. Oh,
Because
more
they're gray.
Okay.
It doesn't make sense, and that's why I'm saying, I'm putting it right there. Put an equal sign.
Okay.
Equal sign, yeah. It's just another term that, why people say that if you have longer scale, how come we have low? I don't know. People a long time ago decided to do it that way, and that's how they.
Said why?
Yeah.
Why?
So if you increase KVP, you will have a longer scale of contrast? So that means lower contrast?
You got it. Yes.
Okay, so here's where my question comes in. So what does it mean when they say improves contrast?
They have to be more specific. You have to ask them at that point, do you want high contrast or do you want low contrast? Because when they say improve contrast, is ambiguous. I mean, to me, when I hear it, this is me. If I hear improved contrast, okay, a couple things come into mind. This guy or this person doesn't know what the hell they're talking about. And that's why they are saying improve, okay? Or, huh?
Oh, in lab, isn't it for like
Or,
improvement of contrast?
and that's what I said. This is me thinking about it. Okay, all right. Or probably, most likely, just from experience, from hearing that term so many times for so many years, probably what they are saying is, I want high contrast.
Higher contrast, or,
That's
okay.
That's what also comes to mind as well, I think.
that's typically what it needs, right? But a lot of times people do it, improve contrast, because they are still not sure. And so that's why you have to come back with, what do you want? You want high contrast or you want low contrast? Improve it. Well, they don't, at that point, they don't know what they're talking about. Yeah. Right? So careful with your clinical coordinators. When they come and do your film image analysis with you, nail them. If they're saying, improve contrast.
Do you want
What do you
more?
want? You want high contrast or you want low contrast? Okay, and let me know. Because every so often I do a lecture with them, remind them, okay? Because it's something that is sometimes. I do, I'm serious, I do.
Wouldn't say, like to make it easier for a person to understand when you're saying, so do you want like a high difference between the light and dark area?
You're not confusing.
Just trying to figure out how
Any
to
X-ray tech, any X-ray tech, they should know. Any X-ray tech, doesn't matter where they graduated from, where they are from in the world. Once you say high contrast, they should know that. They should know that's a short scale, very few shades of gray. And when you say low contrast, they should understand that that's many shades of gray. Okay? They should, okay? But it's a matter of, a lot of times it's rethinking. And it happens to us. We don't use those terms on a daily basis. So they have to.
That's true.
Yeah.
So this high KVP doesn't really,
Let's say that again.
so with high KVP, you're not really deteriorating
And
the quality of the image.
what do you mean? What do you mean by quality?
Yeah, that's the thing.
Okay, and so you have to go back. You need to go back. What do you mean by quality? Do you want me to improve contrast? Do you want me to improve resolution? Do you want me to improve density? What is it that you're saying when you say quality? Because quality engulfs all of that. Okay, quality talks about, that can mean radiographic positioning. You can say this is a low quality because your positioning is poor. This can be, it's low quality because I see, resolution is poor. So they need to be more specific. But when they improve quality, that's just too many, has too many layers. So they need to be more specific. Okay? But now, here's one, okay? And I want you to pay attention with this one. Just because, and that's what is coming up now. Just because you have high KVP, it doesn't mean that you're going to have low contrast. It depends a lot. Don't write it down yet. Understand it first. Okay? It has a lot to do with the type and the amount of irradiated material that you have. Okay? What happens when you add contrast media? Say you're doing an upper GI. You're using 110 kVp, isn't it? Does your image appears like low contrast? No. You have a very bright area and a very dark area. That's low contrast. Because you added, and that's why the name, hence the name, contrast medium. What do you think they call it? Contrast. There you go. There you go. All right. So just because, and now you can write it down. Okay. Just because you're using high KVP doesn't mean that a radiograph will have low contrast. It depends a lot on the amount of irradiated material and the type of irradiated material. And think about the example I just gave you. Okay. When you're doing an upper GI, a barium minimum, and esophagram. all right, you're using high KVP, but your image is very black and white, very dark areas and very clear areas. So if someone insists on saying, well, no, high KVP, low contrast, no. Maybe they are looking at, I don't know, maybe they're looking at the ribs and the spine. If that's the case, well, yeah, but that's not the purpose of that exam. That exam is you're looking at the stomach, you're looking at the intestines. And so if you're specific to, for this upper GI, for this bariomental, you have high contrast. Okay. All right, so it depends on the thickness of the part and the field size. All right, and we'll look at this. And this has to do, this is specific to the amount of scatter radiation that you're creating. Okay, the wider the field, as we studied in the previous section with collimation and cones, the wider, the more contrast you have, the more, because you have, the more scatter radiation you have, and so the lower the contrast when you open up your field. Okay? So, increased thickness and increased field size, okay, that will increase the scatter. That's what I was saying. Longer scale of contrast. So, Colleen, you were asking me about contrast, and so this is it, this is your answer. Are we good? Everybody? Yeah.
Is there ever a time where there's like more scatter, more fog, but it's degrading the picture to the point where it's not really helping with the long scale contrast, but it's just bad for the picture?
It can get to the point if the scatter radiation is so bad. Say, for example, you're X-raying an abdomen and you do a tabletop. You're using 80 kVp, 90 kVp, no grid. It will be degraded. It might be so degraded to the point that you might need to repeat it. Okay, and so yeah, it can get to that point that is not useful. You have a blend of so many grays that you don't see anything. That's what is nice about high contrast images, right? That's what they are appealing, because it's easier to distinguish between one area and another. But you cannot do every exam at high contrast. There are exams that need a little bit of gray here. All right. So type of irradiated material influenced by the atomic number and tissue. Okay, high atomic number and tissue density. Okay, you will have greater attenuation, more photoelectric interaction. Okay, so large difference in atomic number and tissue density of adjacent tissues will give you high contrast. And this is what I was explaining before, when adding contrast media. Okay, or say, for example, a patient has a foreign object, a bullet, I don't know, a metal piece in the abdomen or whatever. Okay, it's easy to distinguish them. It's easier to see, okay, because it has the subject contrast is higher. Okay, that's why, you know, if, for example, someone has swallowed a penny, it's easy to see it. Easy to see. Okay, someone has swallowed, now someone has a piece of plastic, a piece of rubber. Difficult to see because the tissue density between soft tissue and the rubber is going to be very similar. Difficult to see it. Okay, and so it's very important what type of material you have. Okay, so evaluating contrast. Verify that appropriate range of densities are present. With radiographic film, the optical density range will go from approximately 0.25 to about 2.5. I said this before. Okay, and so you can have a range. You can have scales going from here to here, and that's what is visible to us. Anything above this is too dark. Anything below here is too light. Okay. Obviously, knowledge of anatomy to determine proper difference in densities is necessary. For someone who has never taken an anatomy class and is looking at a radiograph and never looked at a radiograph either, just looked like a blend of grays, isn't it? Has it happened to you guys yet where things are beginning to appear now? Oh, now you can see kidneys. Oh, look at that. Now I can see small bowel. Now, oh, look at that. That might be the spleen. Okay, and as you move on, you will begin to see that things begin to really appear, where before it was like fantastic X-ray. You might be just seeing the spine. Okay? All right. So it takes, you have to train your eyes and your brain, but you need to know anatomy. If you don't know anatomy, then you have a problem. Okay. Contrast mask. This is something that, well, you know what? It can be used. Yeah, it can be used with digital systems. And this is contrast mask. Okay, when you have, and let me go back. We used to use it. Well, there is a trick where we used to use with film. That if your image was too light, say it was too light, you couldn't really see much of the anatomy because it was too light. Okay, what you did, you folded a dark exposed film. You fold it, okay, made a cone, and then you telescope it to that area, and it was perfect. Because it has a lot to do with the light in the environment. Okay, and so with digital systems, what you can do is something called contrast mask. If you have a difficulty seeing an area, black everything out and just circle the area that you're looking at, it will look better. Okay, why? Because it's how our vision works. Okay. You guys remember from your physiology class, cones and rods, right?
Yeah.
What is the function of cones?
Cones see color.
Rods?
Black and white.
Black and white. And what are we seeing here?
Black and white.
Black and white. Have you ever noticed that radiologists sometimes they will look back and they will go here like that on the side? Because you're using your rods. Yeah. And then also what happens at nighttime, which is we're using our rods, okay? A lot of times is black and white vision. It's easier to, if you notice, I mean, pay attention to yourself. When you wake up in the middle of the night, a lot of times you go, and your pupils open up more. Your pupils open up more so you can allow more light to come in. And that's what you're doing when you do this. Your pupils dilate and so more light comes in. Yeah? You notice that your pupils, when you're at night, they just get bigger? All right?
Yeah.
Did you ever try that exercise? I don't know if you guys did that in physiology. You can also massage the back of your head and your pupils just go out.
Why did you do that?
Some kind of nerve thing, but just do that.
My cat too. My cat.
Try it. Don't try it in class on the other
I can hear people's back dilating a little bit.
Yeah, it doesn't work.
All right, so this is what I'm saying. Okay, take a look here. All right, take a look here. See this area here? It's difficult to see what is going on here. By the way, what is this? What are we seeing here? Oh, well, there's pleural effusion. Yeah, I mean, there is a fusion there, but there is something else.
I see a faint outline of something in the lungs too.
Take a look at this. See this line here?
Yeah.
So
I see it.
pneumothorax. See that? See how clear that is? The vessels. See this line here? That's pneumothorax.
Wow.
And it's kind of difficult to see it, but you look at it here now.
Oh, yeah.
See how clear it is?
It's much more clear.
That's why you see that's why you do the masking. That's why you block everything out. And so your eyes can just focus on this small area instead of looking at, yeah, I can focus on this, but I'm still getting information here. Here,
Yeah, I can see
there's
it.
nothing else I can see here. And so it's a lot more clear. See that pneumothorax here? Compared, I mean, here you can see it, but it's just easier. All right, we good? Feeling good? More relaxed now? All right, let's move on. Factors controlling contrast. All right, KVP. All right, let's just stop. I guess some people